Hey guys, welcome back to Future CRNA Learning Solutions. We hope you've been enjoying your lectures and you're retaining some value and information from this. This week we're going to go over lecture number 9, which is the vital role of the CRNA in modern anesthesia care. Certified Registered Nurse Anesthetists, or CRNAs, play one of the most essential roles in modern healthcare. CRNAs are not simply clinicians who administer anesthesia. They are highly trained anesthesia providers who guide patients through one of the most vulnerable experiences in medicine, which is surgery, procedures, pain management, and recovery. What makes the CRNA role unique is the combination of two powerful disciplines, nursing and anesthesiology. The Nursing Foundation brings a patient-centered approach focused on safety, advocacy, communication, empathy, and holistic care. The Anesthesia Foundation adds advanced knowledge in pharmacology, physiology, airway management, hemodynamics, ventilation, and crisis response. Together, all these skills allow CRNAs to provide care that is both highly technical and deeply patient-focused. The pathway to becoming a CRNA is rigorous. It begins with a Bachelor of Science in Nursing, followed by critical care experience, usually in an intensive care unit. This ICU background is extremely important because future CRNAs must already understand unstable patients, vasoactive medications, ventilators, sedation, shock states, invasive monitoring, and rapid clinical decision making. After that, CRNAs complete graduate level anesthesia education, which is now typically performed at the doctoral level, such as DNAP or DNPs. These programs combine advanced coursework in pharmacology, physiology, pathophysiology, chemistry, physics, and anesthesia principles with thousands and thousands of clinical hours. By the time CRNAs graduate, they are prepared to assess patients, create anesthetic plans, administer anesthesia, manage the airway, monitor physiological changes, treat complications, and guide patients safely into recovery. The CRNA's role begins before the patient ever enters the operating room. During the preoperative assessment, the CRNA reviews the patient's medical history, surgical history, allergies, medications, previous anesthetic experiences, and family history of anesthesia complications. This is where risks are identified early. For example, a patient has a history of a difficult intubation or obstructive sleep apnea, malignant hypothermia, severe cardiac disease, COPD, or medication allergies. All of these can significantly change the anesthetic plan. The CRNA also evaluates the cardiovascular, the respiratory, neurologic, and airway systems. These assessments help determine whether the patient is appropriate for general anesthesia, regional anesthesia, monitored anesthesia care, or a combination of techniques. But the assessment is not only physical. CRNAs also recognize the patient's emotional state. Anxiety, fear, and lack of understanding can affect the entire perioperative experience. A major part of the CRNA's responsibility is to educate the patient, answer questions, establish trust, and help the patient feel safe overall. Okay, now the fun part. Once the procedure begins, the CRNA transitions from assessment and planning to active anesthesia management. This includes induction, maintenance, monitoring, intervention, and emergence. During induction, the CRNA administers medications that may move the patient into an anesthetized state. This may involve intravenous medications, inhaled anesthetic gases, opioids, benzodiazepines, neuromuscular blockers, or other adjuncts depending on the patient and procedure. Induction is a high-risk moment because the patient can rapidly lose consciousness, they lose the protective airway reflexes, and spontaneous ventilation, and their hemodynamic stability. The CRNA must understand drug dosing, onset times, duration of action, side effects, and interactions. For example, some medications may lower blood pressure, suppress breathing, alter heart rate, or affect airway tone. The CRNA anticipates these changes before they even happen. Airway management is one of the most critical responsibilities of the CRNA. Once anesthesia takes effect, the patient may no longer be able to maintain their own patent airway. The CRNA becomes responsible for oxygenation and ventilation. This may involve simple maneuvers such as a jaw thrust or a chin lift, or advanced airway devices such as an endotracheal tube or a supraglottic airway, such as an LMA. The goal is always the same: maintain oxygen delivery, remove carbon dioxide, protect the airway, and prevent complications such as hypoxia, aspiration, or airway trauma. Throughout the procedure, the CRNA continuously monitors the patient. This is not passive observation. It is an active interpretation of real-time physiologic data. Heart rate, blood pressure, oxygen saturation, end-tidal carbon dioxide, respiratory rate, temperature, electrocardiography, airway pressures, anesthetic depth, urine output, blood loss, and laboratory values may all guide decision making. For example, a drop in blood pressure may be caused by anesthetic-induced vasodilation, blood loss, decreased cardiac output, or positioning. A rise in end-tidal carbon dioxide may indicate hypoventilation, increased metabolic activity, equipment issues, or malignant hypothermia. A sudden drop in oxygen saturation may suggest airway obstruction, bronchospasm, aspiration, atelectasis, or disconnection from the breathing circuit. The CRNA must act quickly and interpret the cause and act. This is where CRNA practice requires constant adaptation. Anesthesia is never static. The patient's physiology changes throughout this case. Surgical stimulation changes, blood loss and fluid shifts occur, medications wear off, ventilation needs to be changed. The CRNA adjusts anesthetic depth, fluids, vasopressors, ventilation, analgesia, muscle relaxation, and other interventions in real time. CRNAs are also trained to manage complications. Allergic reactions, for example, can range from a mild rash to severe anaphylaxis. The CRNA must recognize early signs such as hypotension, bronchospasm, swelling rash, or difficulty ventilating. Management may include stopping the triggering agent, administering epinephrine, giving antihistamines or corticosteroids, supporting blood pressure, securing the airway, and initiating advanced life support if necessary. Cardiovascular complications are also common concerns during anesthesia. Hypotension, hypertension, bradycardia, tachycardia, arrhythmias, and reduced cardiac output can all occur. The CRNA may treat hypotension with fluids, vasopressors such as Neo or Levo, or adjustments in anesthetic depth. Hypertension may require deeper anesthesia, analgesia, beta blockers, or vasodilators. Arrhythmias require rapid recognition and treatment based on the cause and severity. Ventilation and oxygenation are another major focus. Anesthetic drugs can depress respiratory drive and alter airway tone. Patients with asthma, COPD, obesity, sleep apnea, or restrictive lung disease may be at higher risk. The CRNA monitors oxygen saturation and end-tidal carbon dioxide while adjusting ventilator settings to maintain appropriate gas exchange. If a ventilator problem occurs, the CRNA must be ready to manually ventilate the patient immediately. At the end of surgery, the CRNA manages emergence. Emergence is not simply waking the patient up. It is a controlled transition from anesthesia back to consciousness, spontaneous ventilation, protective airway reflexes, and physiologic stability. The CRNA reduces anesthetic agents, reverses neuromuscular blockade when needed, treats pain and nausea, and assesses whether the patient is ready for extubation. Extubation is another critical moment. Before removing an endotracheal tube or airway device, the CRNA evaluates respiratory effort, oxygenation, airway reflexes, level of consciousness, muscle strength, and hemodynamic stability. After extubation, the CRNA continues to monitor for airway obstruction, laryngospasm, hypoventilation, desaturation, aspiration risk, or respiratory distress. The CRNA's responsibility continues into post-op care. In the recovery phase, patients may experience nausea, pain, dizziness, confusion, respiratory depression, airway obstruction, or hemodynamic instability. CRNAs help manage these issues through medications, regional anesthesia techniques, oxygen support, monitoring, and communication with the recovery team. Pain management is especially important because uncontrolled pain can increase blood pressure, delay mobility, increase stress response, and reduce patient satisfaction. CRNAs also work far beyond the traditional operating room. In labor and delivery, they provide epidurals and manage obstetric anesthesia. In pain clinics, they may participate in regional blocks, epidural injections, and chronic pain strategies. In rural and underserved areas, CRNA'S may be the primary or sole anesthesia providers, making surgical and OB care possible in communities that might otherwise lack access. They also contribute in outpatient surgery centers, emergency settings, trauma care, critical care transport, and military or austere environments. Another defining feature of CRNA practice is the balance between autonomy and collaboration. CRNAs are trained to function as independent anesthesia providers, making critical decisions and managing complex clinical situations. At the same time, healthcare is team-based. CRNAs collaborate with surgeons, anesthesiologists, nurses, respiratory therapists, and other specialists to create the safest plan for the patient. Autonomy and collaboration are not opposites, they work together. Autonomy allows CRNAs to act decisively, while collaboration strengthens patient care through shared experiences. Ultimately, the CRNA is a guardian of patient safety throughout the entire perioperative continuum, from preoperative evaluation to induction, airway management, intra-op monitoring, crisis response, emergence, extubation, and post-op recovery. The CRNA is constantly assessing, anticipating, intervening, and advocating. The importance of the CRNA role cannot be overstated. CRNAs combine compassion with technical expertise. They bring ICU-level thinking into the operating room. They understand physiology, pharmacology, ventilation, hemodynamics, pain control, and patient-centered care. Whether practicing in a large academic hospital, a rural facility, a surgical center, labor and delivery, or a pain clinic, CRNAs can help ensure that patients receive safe, effective, and high-quality anesthesia care. In summary, CRNAs are essential members of the healthcare system because they do far more than administer anesthesia. They assess risk, create individualized plans, manage life-sustaining functions, respond to emergencies, collaborate with the surgical team, and guide patients safely through surgery and into recovery. Their role represents the powerful intersection of nursing, anesthesia science, clinical judgment, and patient advocacy. That is the vital role of the CRNA, to protect, to anticipate, to intervene, and to guide patients safely through some of the most critical moments of their healthcare journey. Thank you. We hope you enjoyed this lecture and see you for our next lecture. Thank you very much. Future CRNA Learning Solutions.